Hello everyone, this is Dr. Sushma, Pediatric Ophthalmologist, consultant at Rainbow Children's Hospital, Banjara. So today I am going to talk to you regarding far sightedness, which is also called as hyperopia or hypermetropia. So what is this far sightedness? As the name mentions, the child or a patient, whoever has this condition, can see far objects clear compared to the near objects. That means near vision will be blurry when compared to the distant one, which is exactly opposite to the condition called as nearsightedness or myopia, where far vision will be blurry compared to near vision. So in this far sightedness or hyperopia, the child or the patient or the adult, whoever has this, the near vision will be blurry. So why does this happen? This is purely a structural change in the eyeball. It depends on the curvature and size of the eyeball. Curvature in the sense the front part of the eye, the black part of the eye, we call as outer surface of the eye, which is called as cornea, is relatively flat compared to what it has to be. So that is the reason this hyperopia can happen. So the flat corneal curvature. Or the second thing is size of the eyeball, the axial length of the eyeball. If it is smaller than what it has to be, again can result into hyperopia or hypermetropia. So the small size of the eyeball and flat curvature of the eyeball are the reasons why this will happen. And how can we prevent or how can we do something for this not to happen? To be frank, there is no preventive measure to stop this because it is totally dependent on the structural growth and shape of the eyeball. But if we can identify and treat it early, then we can avoid many multiple vision issues. I say it is important to identify and treat it early because if any child who has this hyperopia and if we don't identify and treat it until they grow like up to 6 or 7 years, then the vision will not improve later on. The eye will end up having a condition called lazy eye syndrome. So identifying on time and treating it on time will save the vision. And how can we identify? What are the symptoms to look for? In a very young infant or very small kid, if they have hyperopia, they tend to avoid near play. That means they don't show interest in the near activities. That is one thing. And they even often rub their eyes when they have to play with some toys or when any kind of near work. And third thing is we see cross eyes in these kids. The child, whenever want to see something clearly, will put an effort to make it clear. In that effort, the two eyes will come close to the nose. So this is called as cross eyes. Whenever any child has cross eyes, we need to rule out this hyperopia. These three things like often eye rubbing and dislike for the near play and cross eyes when playing are the three symptoms which we can see in young kids to identify this hyperopia. And coming to middle-aged adults or even school-going children, we see sometimes they often complain blurry things while reading and writing, and also they have too much of eye fatigue. If they continuously sit for reading or writing, the eyes will get fatigue easily. Often headaches will happen and eye pain will happen. These are the symptoms which we see in adults and young kids. So whenever any child complains of blurry near vision, it's always important to rule out hypermetropia. So once we have a checkup and if we diagnose this hyperopia, we can treat simply with a pair of glasses or sometimes even contact lens. And the last option is even laser eye surgery is also there to correct this hyperopia. So this is very important to identify and treat it early. Otherwise, the child or adult may end up having lazy eye syndrome, which is very difficult to treat later on. Thank you.